Regional Medical Group. So let's hear it and give a warm welcome to Dr. Orna Gil.
It's an honor and a pleasure to be here. It's really, truly an honor for me because of the welcome I've received from our community, how you've all welcomed me and my family into this community. It's just beyond, I can't even say thank you enough. This is an honor for me to talk about specialized care for women. So today we're going to talk about, red. Why are we talking about red? Red is the color of our lifeblood. It's the color of our reproductive organs. It's the color we're wearing loudly on our sleeves today. It's the loudest color, and it's the color that I want to say from my lips, read my lips, or read my lips. All right? Women's health matters, okay? And we need to understand that women's health matters because it's part of healthcare that sometimes doesn't get its own venue. And so in this case, we're going to talk a little bit about specialized care for women. And that means we're going to talk a little bit about our heart health. We're going to talk about cancer. We're going to talk about bones. Those are the main things I'm going to talk about today. And specifically with information that empowers you. Okay, because information is power, and this is the time for us to start to learn how to approach our physicians, our providers, and enjoy the experience rather than not want to go to the gynecologist. Okay, so why do we need to talk about specialist care specifically? The reason is that most studies are done by men, for men, on men, and they really give us a lot of information about men. But today I'm going to talk about studies that are on women, and I'm going to talk about studies for women and by a woman, telling you all that there are some things that we need to be aware of. And by the way, I also want to say welcome to all the gentlemen in the room. Thank you very much for coming and participating. We love you all. Okay. So I want to make sure that we all know we are large and in charge. We are the consumers in the healthcare environment. We make the appointments. We run the nutritional factory in the house. We take people back and forth. We decide what doctors all the children and husbands go to. Right? So we are large and in charge. We need to know that. And so we are consumers, and we need to start to act like consumers. And we're not victims. We're not subservient. We don't have to be obedient, okay? You help your providers. Yeah, you tell them. You give them the knowledge you have about you. And that way, the knowledge that I'll give you today, or give you some sort of idea about how to look at it, I hope will allow you to not be a victim of the crisis of disease. So, we want to avoid the crisis of disease. How are we going to do that? We want to embrace a provider who will not just tolerate the conversation, but will converse with you. Go back to that person. Don't go to anyone who will brush you off. We're going to talk to someone who will enjoy the conversation with you and listen to what's going on with you. And also listen to yourself, like Jeannie. Brilliant speech, by the way, Jeannie. Wow. That really, listen to your own self. Feel the feels. All right. So with regard to heart health, cancer screening, bone health, we may get to hormones, but probably those will just feel right now. So to start with, heart disease is the #1 cause of death in women. And it's important because these screening tests and interventions can really help us enjoy the life that we really want to live. And I want to emphasize that the most beautiful things in life are those that we don't want to miss. Those are my two baby puppies, Basil and Maximus, and my niece and nephew, Liav and Nina, and our son and daughter-in-law who got married this year. Congratulations to them. And so all of these things, we never want to miss. We want to remember that this is what we live for, and we have to stay on top of it for ourselves. So don't let your heart break, because women, we are kind of famous in the medical community for not having our hearts broken medically. In other words, everybody thinks women don't get heart attacks, but we do. We get them, and we get cardiovascular disease. Every 80 seconds, a woman dies of cardiovascular disease. And 80% of those deaths could have been prevented, which is why it's so important today to talk about that. All right, so like Deanie was saying, there are things we can control and things we can't control. So risk factors that you can control: cholesterol, blood pressure, smoking, obesity, exercise levels. What we can't control: our age, our race, our heredity, our background. It's my third language, what can I tell you? You know, those are the basic things that we really, and if you've had a heart attack before, in other words, your heart history, as Deanie was saying, that's another thing that we have to pay attention to. All right, so blood tests, you know, we want to make sure that we get our cholesterol checked, we want to make sure that we get our blood pressure checked, we want to make sure that we have our weight checked, our circumference of our abdomen checked, our BMI. We want to talk about fitness, etc. And there are different times that, you know, there are different times we can get these all checked. In general, starting at age 40 or 45. But I want to talk to you about something specific to women. And this is going to be, in my opinion, a little bit of an aha moment. First of all, blood pressure. This slide is just a bunch of colors. What it's trying to say is 120/80 and less. That's it. Don't go over that. If you do, you need to talk to these geniuses down here, the doctors over here, and let them talk to you about how to keep it down. All right. So what are the signs of heart attacks and stroke? Deanie was talking a little bit about it. It's not just an elephant sitting on your chest. For women, it can be jaw pain or nausea or like excessive Tums use, you know, that kind of stuff. Any kind of need that you have where you feel sick or sweaty or weak. In terms of stroke, if you can't speak so well, you start slurring, or if some part of you doesn't feel like you can pick it up so well. You want to make sure to pay attention to those signs and not dismiss them. Okay. So this is a big aha moment. It's very important for us women to know that pregnancy is the biggest stress test on the body that you can have. So that is actually a predictor. How you did in your pregnancy is a predictor of your short-term and long-term cardiovascular health. So in fact, it's a big deal. There's a bunch of studies now coming out that show that harnessing the events of pregnancy and utilizing them to really know what's going to happen to you in the future from a cardiovascular health disease perspective. And what we found out is if you deliver early, before 37 weeks, if you deliver early before 37 weeks, you have a higher risk of heart attack and stroke. If you deliver before 32 weeks, you have a 3 times higher risk of stroke and heart disease. If you have preeclampsia in pregnancy, 75% chance of cardiovascular disease. Diabetes, all of this stuff is important. So for example, if you had a history of preeclampsia or early labor, get your cholesterol checked more often and get it checked soon. Okay, not every 3 years, every year, every 2 years. If you had diabetes in pregnancy, gestational diabetes, there's a 50% chance that you will develop diabetes in 10 years, overt diabetes. So get yourself checked early and often, just within the first year, and then every couple of years after that. because we want to make sure that we control and know we can control our health by knowing our pregnancies and knowing that that will help you to better understand what's coming up. So, at least pregnancy does predict disease, but at least now in old age we can drink. So that is a bit of easy. All right. I want us to open our eyes to cancer and cancer health. I want to talk about cancer prevention, vaccine, identification, etc. It's the big C word that no one really wants to talk about, but we're going to talk about it because after heart disease, it's the #2 killer of women. Okay, 1 in 3 women are going to get cancer in their lifetime. So that's something that we need to identify and prevent if possible, and intervene very, very carefully and quickly, immediately if we can. So, as you'll see from this slide, which I made difficult to see on purpose, there's a bunch of different entities. There's a big debate about breast cancer screening, and there are a bunch of different entities that have different recommendations. So, for example, I would say in general, you want to start at age between 40 and 49, at the very latest 50, and then have your mammograms every year or two, okay? The U.S. Preventive Task Force states that you don't need to do breast exams anymore. Your doctor doesn't need to do breast exams anymore. That's a recommendation. However, keep in mind that 1 in 6 breast cancer patients is under the age of 45 before mammograms are a thing. So, I would say your opinion and your knowledge matters. You take what you got from this and you do what you got to do. And tell your doctors, hey, you know what? I want to be not 1 in those 6 cancer patients. Start checking according to ACOG at age 23 every year to 3 years. All right. 75 years old, but that's up to you. Almost there, huh? That's right. It's never ending. I want to talk about a topic I'm very passionate about, the HPV vaccine. And HPV, basically the genital wart virus, is a virus that affects not just the cervix, but the larynx, the anus, the penis. This virus does go into cells, transforms them, and turns them into cancer. We have a vaccine now to eliminate it. So that's what I want to emphasize today. Think about it, a vaccine to cure cancer. If everyone had it, we wouldn't have all these things going on. So the vaccine is recommended for the ages of 11 and 12, something around there, and it's 2 shots. After the age of 15, it's 3 actual shots. And you can go up to age 26, but some people say go up to age 45. And some oncologists give their patients the vaccine to help their immune systems fight the cancer. So again, information is important. And this slide is a little old, I'll tell you for real. This vaccine, since its introduction into medicine, has decreased cervical cancer by 40%. Okay, 86% of teens now, HPV-mediated disease in teens is down 86%. In young women, 71%. And only 6 out of 10 parents choose to vaccinate their children. But in this community, we're going to go up in that. We're going to do that. Okay, so that's a passionate, I really look at it as like a cancer vaccine. So consider that and take that information to your doctor or provider. Okay, so in general for cervical cancer screening, there's been some debate. They finally settled it out. At age 21, we're going to start and do it every 3 years until the age of 30, where you go every 5 years. But really, we're really just looking for the virus itself. We don't even care about the cells. So you can really skip a lot of the cytology and just check for the virus after the age of 30. When do we stop? That was another question. Everyone wants to know when we stop. And 65 is when you we recommend that you no longer need any of this testing. Okay. So I want to talk about colorectal cancer screening because it's the number 4 cause of cancer in women, and I know it's a pain in the ass to do it. It's really very, very important. They should colonoscopies. Get them done at the age of 50 and above, and at least every 10 years. It's 1 in 7 people have colon cancer, so that's a pretty high number. All right. So, I want to talk about the bones, because the bones are important in women. It's a very important topic. Number 3 important topic. Make no bones about it, the bones is important. All right? Why? Because if you have a hip fracture after the age of 65, 1 in 3 women are going to die in a year. That's a fact. And the other 2 are not going to do so well, believe me. In 5 to 10 years, they also die, and they have a very, very unpleasant course. So let's find out about our bones, and let's make sure that they don't fracture. Let's be careful about that. So basically you want to get started at age 65 and check every couple of years, no more than every 2 years. And no less than every 2 years. And you want to start at age 65, but there are some caveats. You're going to want to start earlier. If you smoke, or if you have smoked, if you like to drink the wine, so if you drink a couple of glasses every day, yeah, that's pretty much everyone in the room. If you're 127 pounds or less, that's another risk factor. If you've had fractures in the past, you want to check them. So make sure we all stay healthy for the ones we love. Make sure we get it done together, go red, because we got to get it done, get all of your screening done, because we are all in this together. We're all mothers, sisters, daughters, friends, aunts, colleagues, granddaughters, and grandmothers. Thank you for your time. Have a beautiful day.